We've relied on them now more than ever. Frontline workers in hospitals working to save lives amid the COVID-19 pandemic. But that work is far from easy. Their normal routines have changed, and even the way they show empathy looks different. In this Rebound Kansas City series, we talk with several frontline workers who are pushing through the challenges while providing comfort to others. Tonight, I want to introduce you to Dr. Stefanie Ellison, a wife, a mom, and emergency physician at Truman Medical Center. We've all had rough, emotional days at work, right? But very few of us have had days like Stefanie Ellison.
I just finished a really tough shift today in the ER. We had a lot of very sick patients today, some emergencies that had to go to the OR. And I'm exhausted.
Dr. Ellison is an emergency physician at Truman Medical Center, a mother of 3, a wife to 1, and caregiver to dozens, each day presenting new challenges.
I just finished another shift in the ER, and thankfully I had my N95 mask on underneath for my last 2 patients because they were both positive for coronavirus.
Walk me through your most challenging moment or most frustrating moment since mid-March.
So I'm a doctor and I like to understand and know how to do everything. And the most challenging thing is how quickly this has changed.
Changing by the day, by the school district, and by the jurisdiction.
I live on the Kansas side, I practice on the Missouri side, I have family in Nebraska, and so I'm consistently trying to stay in the know on those things and advise family members when they ask me what they should do.
This is just one of the masks that I wear. It's a level 2 mask, a KN95.
Dr. Ellison describes her attire while in the ER and says she and her colleagues often over-communicate to make sure they have adequate protection.
And then I also apply these goggles. I am protected from droplets going in my eyes.
Safety, no doubt, a top priority.
We're good at pivoting in emergencies, but this one's coming at us faster than most things we've ever done.
Coming so fast, Ellison says she knows of at least 7 other hospitals in the metro with higher than normal volumes, some even running out of beds. And it's not just coronavirus, but side effects you may not think of.
We are seeing increased numbers of depression and anxiety, substance abuse and alcohol abuse. And so it's changed things socially for everyone.
If there's just one takeaway you have for our viewing public, just in this day and age of COVID-19, what would that be?
I want to invite you to imagine a person who's very dear to you in your family who might have one chronic condition who's over the age of 50. And those that we know to be our patients that are most likely to have a bad outcome from coronavirus. And so as you go about your day, when you leave your house, make sure you have a mask. I carry a bottle of Purell with me everywhere. And wear that mask for that person.
Ellison says only about 3 to 5% of COVID-19 patients get critically ill. And while that may or may not seem like a lot to you, she's dedicated to keeping that number low, making sure her patients, her family, and she herself don't fall victim.
This is not just I caught the flu and I recovered completely. A lot of patients are not able to recover completely, even if they survive this virus.
Dr. Stefanie Ellison, one of many frontline workers we've talked with as part of this series. You can read them all at kshb.com/rebound. Click on Managing the Pressure.